Now we'll look at another test which is usually done in the lab, and this is what is known as a piano key test. Piano key test. So for the piano key test, let's quickly look at what it is. I say, of course, there's a red mark here because what? There's pressure applied to that place. Okay. So I think it should be two-way stuff. So piano key test or a piano key sign is used to access the instability of the distal radioulnar joint, okay, and the triangular fibrocartilage complex in the wrist. Okay. So you can ask the patient to move their hand like that to see how they can be able to obey that instruction. So purpose is to evaluate the stability of the distal radioulnar joint and integrity of that triangular fibrocartilage complex. So it helps to diagnose all those wrist pain, instability, especially after a distal radius fracture, or if you suspect that triangular fibrocartilage complex has actually torn. Okay. So how is it performed? The patient forearm is placed in a pronation, so the palm is facing down. See, for all of this it was facing down. Okay. So the examiner stabilizes the distal radius with one hand. I think this was what was done here. Okay. With the other hand, the examiner presses the ulnar head and prominent bones on the wrist. Okay. Similar to you pressing a piano. So the examiner observes the movement and resistance of the ulnar head. So if it is positive, there's excess mobility of the ulnar head. Okay. Then what? So a springing back motion is pressured when pressure is released. Okay, so that's just it. You can also tell the patient to actually move like this, as if they are playing a piano, just so you can be able to look at this place, to look at the strength there. Okay, so that's what we got for the piano key test.